Gentlemen, it's another time. Are you ready now? Let's go. They put their feet, man. They gonna watch them feet. So you see this feet line. You know go see it, See we gonna play them tape, man. So you see this tape.
Your Excellencies, our distinguished leaders, colleagues, ladies and gentlemen, it is now with profound honor that we'll invite for his keynote address the immediate past president of this association, Pharmacist Professor Cyril Usifoh, Fellow of the Pharmaceutical Society of Nigeria, and the keynote speaker for the 2026 Pharmaceutical Society of Nigeria, Colloquium.
Pharm Professor Cyril Usifoh obtained his B.Pharm degree from Obafemi Awolowo University, Ile-Ife, between 1979 and 1983, MSc from Sussex University, Brighton, England, between 1984 and 1985, and his PhD from Westfälischen Wilhelms University, Münster, Germany, between 1988 and 1992. He joined the services of the University of Benin in 1993 and was promoted to professor in 2003. He was head, Department of Pharmaceutical Chemistry from 2003 to 2005, Dean, Faculty of Pharmacy between 2006 and 2010. He has successfully supervised several MSc and PhD students. 6 are professors, and 2 have served as Deputy Vice Chancellors at the University of Benin. He has over 110 scientific publications in reputable journals. He has served and is still an active member and or chairman in various committees and subcommittees within and outside the University of Benin. He has been and still is an external examiner to some Nigerian and foreign universities, a reviewer to several national and international journals. Professor Usifoh is a recipient of international and national awards, to mention a few, such as Sir Adam Thompson Scholarship UK, German Academic Exchange Service DAAD, Tetfund National Research Grant, and 13th edition of the May and Baker Professional Service Award for Excellence in Pharmacy 2017. He is a member of European Association of Pharma Biotechnology EAPB, Quantitative Structural Activity Relationship Society, International Society for the Study of Xenobiotic, International Society for the Development of Natural Products ISDNP, International Society of Pharmacoeconomics and Outcome Research ISPOR, Royal Society of Chemistry, and so on. As Chairman, Edo State PSN, Professor Usifoh strengthened the inspectorate team for proper enforcement of necessary regulatory activities. As president of PSN, he inaugurated Form Jimmy Agbaje FPSN OON as the first chairman, Board of Trustees BOT of PSN, with other members as Form Azubike Okwo FPSN, Form Olumide Akintayo FPSN, Form Ahmed I Yakase FPSN, Form Sam Owabunwa OFR FPSN, Form Mrs. Bob Manuel Elizabeth FPSN, Form Mrs. Zainab Sharif FPSN, Form Dr. NAE Muhammad FPSN, and Form Dr. UNO Uwaga FPSN. This Board of Trustees is the first since PSN was officially incorporated under CAMA in 1956. President of the Federal Republic of Nigeria, late Major General Muhammadu Buhari, GCFR, retired on 16th August 2022, signed the Pharmacy Bill into law to become Pharmacy Council of Nigeria Act 2022, with efforts from appropriate advocacy work with other stakeholders led by Professor Cyril Usifoh. Professor Usifoh is the immediate past president of PSN, a former chairman at Edo State Pharmaceutical Society of Nigeria, former editor-in-chief, Nigerian Journal of Pharmacy, fellow Pharmaceutical Society of Nigeria, fellow West African College of Postgraduate Pharmacists, fellow Nigerian Academy of Pharmacy, a member of the Catholic Charismatic Renewal, and an extraordinary minister of the Eucharist, St. Patrick Catholic Church, Ugbowo, Benin City. Professor Usifoh is happily married to Form Stella Usifoh, a professor in the Department of Clinical Pharmacy and Pharmacy Practice, Faculty of Pharmacy, University of Benin. Ladies and gentlemen, it's my pleasure to present to you Professor Cyril Usifoh, FPSN, immediate past president, PSN, keynote speaker.
Thank you very much for the kind words. If I start with the protocols, we might spend some time, and I think the glucose level is a little bit low. But permit me to especially acknowledge the governor of this state that was ably represented by the deputy governor, who is a ASU person struggling. You know, we are always demonstrating for our rights. The chairman of this occasion, my big brother, pharmacist Yaro Buddha. At times I wonder whether his forefathers are from India. The chairman BOT, who graciously accepted to chair the Board of Trustees, and indeed all the Board of Trustee members that are physically present. I want to, in a special way, acknowledge all the past presidents, my sister all the way from Atlanta, Georgia, for coming to grace this occasion. I've been saying, talking about my president, because as you can see, it's always very happy when somebody is close to his left or his right. And in a special way, I want to acknowledge Mrs. President, Mrs. Ibrahim Tanko Ayuba, for all the support that she has always given to our president. And you and I are witnesses, because Madam wasn't around, she returned Adamawa to Taraba. So if I mention Taraba and not Adamawa, please don't blame me. I'm only following the footsteps of our president. Let's look at the first slide. When we talk about pharmacy education, many things come to mind. I recall the nostalgia when I entered IFE, and we always said that pharmacy was for learning and culture. For pharmacy, IFE is for learning and culture. But for me, some of my colleagues refer this for learning and torture because of the way our former teachers made us to pass through. In fact, that was one of the catalysts that made me to go into academia. I decided that when I come into academics, I will make a difference. And in fact, some of my students later I found out they call me ProfessorEasy.com. Pharmacy doesn't need to be very difficult. You need to make it easy for people to understand. And the truth is that when they understand, it's a lifelong learning. I challenged my previous students one time when I told them I read till about 1 a.m. and woke up 5 to do something. People, you're still reading. I say, if I don't read, don't you hear it's pharmacy practice? I must practice this profession. Second slide. Access to medicine is a fundamental human right. It's not something that only the privileged have. Because if medicines are accessible and also affordable, talking about pharmacoeconomics, if they're accessible and there's no money to buy, then it becomes a problem. Then we can save life, we can reduce mortality, and we can also reduce mobility, especially those that are associated with acute and chronic diseases. The WHO recommends that all countries voluntarily should reach the minimum target of 80% availability of medicines by 2025. This is 2026. Do you think we've arrived at in Nigeria? The answer is no. Next slide. And therefore, the access to essential medicine, like I mentioned, is fundamental to effective healthcare delivery. Without access to these necessary medications, the individuals you and I, with acute or chronic conditions, may suffer from worsening health outcomes, including mobility and mortality. I'm also with the fact that where the pocket is there with people out of pocket, more than time out of pocket expenses, we may not be able to achieve what is needed. I found out that people actually treat themselves at home and manage, and their body try to recover. It's only when it becomes very tough, they come to the hospital. When I sat on the UPT for one of the things I discovered was that people every month, we had about 4,000 to 5,000 mortality cases. I had to challenge the CND, and we wanted to know why people were having difficulties, why things were going the way they were going. And we found out that when you make people accountable, they will pay attention to needs. And pharmacy is the pivot for which most things go on in the hospital. Pharmacy education, according to FIP, the education that develops a competent, professionally educated pharmaceutical workforce for diversity of settings, through different stages, whether undergraduate, postgraduate, whether continuous learning. And the truth is that, I think you're moving a little bit very fast, that it has to happen within an academic or institutional infrastructure framework. That is to say, you must have a particular space where people can gather together. You and I have been privileged with the fact that our deputy governor people saying that she's a classroom teacher. There must be that sector. And I'm happy to let you know that the School of Pharmacy in Adamawa will be established and it has come to stay. Next slide. I will show you that I can tell you without reservation that we will liaise with government, with NAPA chair, with my sister in diaspora, and a couple of us will form the workforce to make sure that this faculty of pharmacy stands in Adamawa. Capacity of the Nigerian workforce continues to increase, whether we like it or not, and demand for healthcare services rises daily to meet complex disease conditions. You may be in your pharmacy, you may realize that you need to do more than what you have been taught in the School of Pharmacy. I will tell you one thing, that the advancing the role of pharmacy, despite the difficult healthcare terrain, is to make sure that we have relevance and capacity, because it's more important than now. When my wife was in community pharmacy before she decided to join me in academia, you see, the time she was the first lady chairman of then it used to be NGPP in Edo State. I would go to her pharmacy to practice, but she never paid me. One day I had a visitation from a physician colleague who brought a prescription for it to say. And he said, where is the pharmacist? I came out, I was there, and I said, please dispense this drug. I said, why do you need this? Is the patient in the hospital or at home? One thing people don't know is that pharmacists are very smart people. I found out that the surname of the patient and the surname of the person that signed the prescription, the physician, were the same. I didn't know whether it's the sister or the wife or whatever. I would spare us the story. But at the end of the day, it became clear that we have to exchange some words. Who will exchange your words? And I told him, you can go to faculty of pharmacy and ask about who I am. When he was properly educated, he agreed with me that it was wrong to have written a prescription for the wife. And I told him, take the wife to the hospital, otherwise you will kill her. When I was sure he was properly educated, I handed over the prescription back to him and I said, I'm so sorry, this pharmacy doesn't have oxytocin. Go to the hospital. We became friends thereafter. And so pharmacy education is undergoing a significant transformation to shift from a focus on dispensing to patient-centered clinical care and making it possible for us to have a professional workforce. I want to challenge my colleagues in academia. Please, if you use the notes you used last year to teach students this year, something is wrong somewhere. There must be improvement. You must be able with your colleagues in the hospital, in the industry, even in administration. Some people who think I'm retired, but they're very active like Vice President Yagasar. Get information so that we can teach our students. Come to Herbal Medicine, for example, meet Dr. Zakari. She will give you an up-to-date of what is going on presently. And that's why the University of Benin, for example, we decided, and that's what we are doing. We invite people from other arms of pharmacy to come and teach our students so that we have that experiential knowledge. It's the difference between what you learn in school and what you are passing through in practice. And some of them love the representing an interview. Some of them opted to come into academia. So they are bringing their experience from the practice background into the academic sector. I hope other universities to pass that so that this evolution involves adopting competency-based curricula, fostering professional collaboration, because we also make sure that not only do we go to hospitals, we attend even clinical meetings to bring our own knowledge to our colleagues in the hospital. And in doing so, we'll be able to embrace new technologies to prepare patients, prepare pharmacists for diverse and evolving roles. I must challenge and tell our colleagues, don't be afraid of a computer, don't be afraid to learn something. When you learn, you can only improve yourself. And this is include training and capacity building, driving quality and standards, and globally benchmark competencies. Next slide. Pharmaceutical education as a catalyst involves one, shift in competency focus. Here, modern pharmacy education is moving away from purely basic science towards what? Clinical practice, emphasizing skills in pharmacotherapy, critical thinking, problem solving, and decision making. I remember what happened on one occasion. One young pharmacist brought a solvent to us. His whole question was that this solvent is working in the industry, pharmacist company. He used that the person who is working with all the pharmacists use this particular solvent, and obviously an alcohol, to prepare paracetamol syrup. And I asked him why. He said, I take alcohol, so I know how alcohol smells. But this one doesn't smell like alcohol. I became interested. And while we were busy talking jargons, HPLC, GC, I said, look, this guy doesn't have these facilities. One simple thing, alcohol boiling point is 78, let alcohol boiling point is 64. Within 5 minutes, I will tell you what it contains. I had a micro distillating apparatus, and I did that right in my office. I was shocked, I nearly collapsed, because that one had been formulating paracetamol syrup with metamol, and that caused brain damage to a lot of children. Things like this should be allowed to exist. I don't know whether I reported them to NAFTA or to PCN how many years ago, but these are things that we believe that we need to have critical thinking and shift, not just academic bookwork, but with practice setting. It also requires professional identity formation. Education now allows us to instill core values, ethics, and professional behavior, helping students, especially as they become young pharmacists, transiting them from learners to healthcare professionals. When I was doing that, I made sure that those of us in practice, I invited people like Oscar J and the rest of them to talk to my students so that they will be able to instill some core values to them. It might interest you to know that one time we had a running battle with the PCN staff. By then, our double prophet was the registrar, and this man was the ECPN chair. I won't go into details, but we moved him out of those days. If it wasn't practicing pharmacy the way it should have practiced. But I hear he's still practicing somewhere. Maybe we will tell Babashi to do the right thing. Curriculum evaluation, emerging curricula, we should tailor our curriculum to what we need here. Not just import them, with due respect to my sister, even if we get them from the US, we must adapt them to what we have in our country. And in that way, we should be able to do something. You can't be a pharmacist, and the average temperature here is about 39, as I'm observing. I think the difference was 40. And you store your drug, and you expect that the drug you are handing over to the patient will be the same thing. Come on, bring in your knowledge in pharmaceutical chemistry as part of the education. That the drugs involved may not be the actual drug you are giving to a patient, except you have the appropriate storage condition. And let's not forget, as things at, we are poor, but we are trying to get out of poverty. Must we begin to calculate the importance of herbal drugs? I think we need somebody to talk to us so that we can incorporate that properly. Not only in our curriculum, but in our practice. Next slide. We also need interprofessional education, like I mentioned, lifelong development, so that people will be able to understand and appreciate what we are doing. Next slide. As we go to the next slide, we want to ask that when you are discussing with your colleagues in the health team, it's not looking down on it, it's a team. And when a team collaborate and work closely together, the outcomes will be great. But when you are teaching other students, you will never not get anything. I remember very well, with joy in my heart, I remember I visited the intensive care center of the Atlanta Medical Center with Dr. Teresa Palm. And myself and Professor Nato, we went through the intensive care, made some comments and discussed with pharmacists and physicians. One physician called to say, please help me thank your colleague pharmacists. I said, for what? He said, they have saved us a lot of mitigation. Without them, we can practice medicine effectively. They tell us about the material, they tell us about drug law, combination and the rest of them. And I expect that to also happen in our present setting, so that at the end of the day, the best will come. I remember I was in O&G ward visiting a cousin of mine that put to bed. And one young doctor walked up to me and said, sir, you won't know me. I said, obviously I don't know you, know I'm older than you. He said, sir, I know you are a pharmacist. Please, can you tell me what is the dose of this drug? I was humble because this young man asked. And I told him, one, I asked myself, if I wasn't knowledgeable enough, I was able to do the right answer. So you need to educate yourself. Two, the system cannot but make you what you need to know. The key drivers of professionalism: one, professional identity formation. This has to be made available, so we will try not to go too much in detail. Because if we have a shift in behavioral training towards initializing core values and beliefs, experiential training, like I mentioned, role modeling will help students transit into practicing professionals. I mentioned, and I'm challenging my colleagues, and I'm hoping that PCA will listen. We need opportunity to be able to talk and practice what we are talking about. Two, competency-based models. The FRT Global Competency Framework is there. You can Google it and then get more information about essential skills, problem solving, leadership, and interprofessional collaboration. And then we also know that training of pharmacists alongside with doctors and nurses foster collaborative care environment. But that's not happening in the universities. We do it separate way. In Liberia, the first 3 years, the pharmacists, the nurses, and the physicians, they all work together. They get the same lectures. It's later they disperse to various. But here, everybody is trying to do what they know best. But that won't help us. in any case, we must also be prepared to imbibe technological integration. I hear that some pharmacists, when they see the laptop, they get afraid. Please don't get afraid. What you don't know, let them teach you. I recall Professor Babiru, former VC of Ibadan, when we had some discussion. He said there was a young man lecturer too, and he went to him and said, look, when I do am VC for this computer, I get afraid. Please come and teach me. And he humbled himself and became a guru later. So we must be prepared to learn and imbibe technology. Next slide. Impact of pharmacy education on workforce. One, they will have enhanced clinical role because graduates are better equipped to serve as medication experts and improving patient care and safety. We have expanded career path. The workforce expands not just to the community but to hospital sector and in specialized areas like oncology, geriatrics and infectious diseases. You know, many of us, we give drugs even to people who are getting younger. If you look at carefully, some people are over 70 years, some 75, you know, 80. You might need to also be careful what you give them. So, geriatric pharmacy is something, I know Sepan is working in that room very well, so that we will give the appropriate drug to the appropriate person. And also we need to know and focus on global standardization with initiative. Next slide. To fully maximize this role, therefore, pharmacy education requires investment. And this is where I'm calling on the governor and government of Adamawa that if you want to start the school of pharmacy, you must know that you need to invest in research infrastructure. Two, you must also invest in increased opportunities for postgraduate clinical testing like residencies. We haven't really started residencies in Nigeria the way I think. She's been championing that. I think that Delta State University have been doing that, but we need to do that. And also a stronger force in developing leadership skills. I want to challenge pharmacists, especially the young ones. You know, if you are in a setting and there are 2 chairs, as a pharmacist, or just one, I will sit on one and I ask my colleagues, where do you want to sit? Well, the knowledge and the things they are giving us in academia from the university is that because we are so like, oh boy, I've got a place to sit. Please take this seat, let me go and look for one. Sit on that chair and ask where the others will sit. It's your right. It's not a privilege. And I think that's exactly what is happening in Adamawa. That the head of service is a pharmacist, a permanent secretary is a pharmacist. I don't know whether very soon the governor will be a pharmacist. Pharmacy education is a critical catalyst for a professionally inclined workforce by involving from a focus on drug dispensing to a holistic patient-centered medical model. This transformation ensures that the workforce is not only technically proficient, but also ethically grounded and adaptable to modern healthcare needs. And this is where we need to talk to our younger ones. They must practice ethically. And you can't practice ethically if you are not willing to learn. If you are willing to learn, you will learn a lot. Next slide. As medicine experts, the pharmaceutical workforce plays an important role, and the continued development of pharmacy services and the pharmaceutical science relies on a well-educated, competent, sufficient, and well-distributed pharmaceutical workforce. Transforming the global pharmaceutical workforce requires a global vision with clear and consensus-based objectives, consistent with some of the practices we are doing and strategies. Next slide. As a pharmaceutical professional, you must make a difference in people's health and well-being. Apart from the extensive knowledge you've gathered in school, you must begin to know that there are some of the nice standards, not limited to these ones. You must also provide person-centered care, work in partnership with others, particularly those in the health team. You must be able to communicate effectively. That's one problem we have in academia. You have some people who are very brilliant, first class material, but they cannot communicate their knowledge to students. You must be able to maintain, develop, and use professional knowledge and skills. You must use professional judgment, as the case will be. I remember during my youth service in, I think that was Bauchi, when I did to the youth service twice. I first of all started in Bauchi, then went for a master's in England, then came back and did it in Osho. But the one in Bauchi was very interesting. We all gathered together, there were two physicians and myself, we went on world round. And as we went on world round, that was the first time I actually was doing that. And my two colleagues said, this lady put to bed, but we have given some drugs, but she's not doing better. Pharmacist, what do you think? And I was looking at them. What's clinical practice? I said, yes. What was your question again? So as I asked the second time, I started processing the answer. And I said, I think, what is the dose that you gave? They told me then it used to be ampicillin, 250 milligram, 4 times a day. I said, no, doctor, that's wrong. For this particular illness, from the prognosis, give a loading dose. Thanks to Professor Gubono. A loading dose of 1 gram. He said, yes, I'm talking as a pharmacist. And then you download it to 500 milligram 4 times a day. We will see the prognosis and see what it is after a day. If it's not getting better, we know what to do. But if it's getting better, we can reduce it. Lo and behold, we came the next day, the woman sat up and she was strong. I said, pharmacist, thank you very much for saving us. I was feeling good. But there was something I added additionally. I had worked on metronidazole in my internship. I have never seen community practice like this of pharmacy. I have never seen IV metronidazole flagyl. I've never seen in my life before. But I quickly went around the pharmacies, and I saw some ampoules, and I asked, what is this flagyl nutrition? I said, does it exist? He said, yes. They were not pharmacists. I quickly read. So when I went back, I asked the doctor, I said, look, put her on IV flagyl 8 hourly for 24 hours, and then we'll review. So that was added, and like I said, the woman got up, who couldn't get up before, and everybody started saying, this pharmacist must be a small magician. Now, I said so because you must be willing to cooperate, learn, read, act fast. I had a professor who is late now. He's a physician, a trauma surgeon. He says, one problem I have with my colleagues who are physicians is this. Somebody's rushed to you. You keep on waiting till the tests come out before you act. He said, that is wrong. From what you have learned, from your knowledge experience, start something. Let the tests come out. If the tests come out, what you are doing is the right thing, you continue. But if it is wrong, you switch. And so that's exactly what you do, because a stitch in time saves time. My next slide, please. Next slide, okay. And so 3 milestones. No, just go back a little bit. I won't go through all the 3 milestone documents of work for which I want you to read later. A global vision for education and workforce, a set of pharmaceutical workforce development goals, and a statement of pharmacy and pharmaceutical science education. These were done in the Nanjing conference in China, where these things were well crafted. Next slide. Investing in the pharmaceutical workforce contributes towards strengthening the health system and achieving universal health coverage by 2030, as outlined in the United Nations Sustainable Development Goal. Our only hope, our vision for Nigeria, is to have a national strategy, an action plan for pharmaceutical workforce. We should be able to assess our pharmaceutical workforce needs and priorities, and then develop these national workforce strategies and infrastructure, and provide a co-created solution, tools, mechanisms, and resources for such. And I hope when we break into syndicate group, we can further break down these things and see what we can do to come up with something that will help our country. Next slide. The impact of workforce, like I mentioned, clinical specialization, and when we want to do that, we have to consider the residency and fellowship pathway, lifelong learning, mandatory continuous professional education, and leadership policy, which should serve as agents of change and policy developers with healthcare system. On leadership and policy, I want to challenge every pharmacist here present, especially when you're in leadership role. You must be able to influence government, you must be able to influence authority. If you are not where decisions are taken, you will just find out that you are part of the menu to be shared. You must not be part of the menu. You must be those who will take decisions that will affect farmers. Next slide, please. Therefore, three critical imperatives. I'm not pharmacist Olumide Akitayo. He likes that word imperative, but I also like it. There are three critical imperatives. One, full integration of pharmacists as clinical and system leaders in the health delivery. Two, the need to reassess the current leadership of the Ministry of Health. I hope I'm not becoming political. In light of the persistent systemic failures and the appointment of a health economist rather than the politically convenient clinician to lead Nigeria's healthcare policy. Next slide. In modern health systems, specialist pharmacists play a critical role in clinical decision support. When I was doing my new service, I mentioned when I didn't have any clinical background, but though I have been taught, I was able to prove that from education, I could from informed decision, we can bring the necessary outcome for the patient's benefit. And therefore, we're involved in medication safety and pharmacovigilance. I'm sure you agree with me. We involve in hospital therapeutic policy, antimicrobial stewardship, oncology and critical care medicine management, public health, pharmaceutical planning, and pharmaceutical manufacturing innovations. Let's go on. And so when people are talking about manufacturing and exclude industrial pharmacies, pharmacy bankoli, I see that as an apprehension. We must involve ourselves, the critical experts. Next slide, please. Next slide. Countries that have strengthened specialist pharmacy training have seen measurable improvement in patient safety, treatment outcomes, and health system efficiency. Nigeria, in fact, Adamawa cannot afford to lag in this area. And so the need for structured pharmacy residency, like I mentioned, is important. That will provide a bridge between academic education and specialist professional competencies. They ensure that professionals gain supervised practical experience under expert mentorship while developing advanced expertise in defined field. Next slide. So for pharmacy, I'm proposing that the national residency framework to include specialty tracks such as clinical pharmacy, oncology pharmacy, infectious disease pharmacy, industrial manufacturing pharmacy, regulatory science, public health pharmacy, pharmaceutical supply chain management. Such programs will help transform pharmacies from general practitioners into high-level specialist contributors to national health security. Next slide. Life is not measured by the number of breaths we take, but rather by the moments that take our breath away. Who cares? You see a young lady, if you are not married, some cases some people are married, they'll say the person took their breath away. That means a defining moment. I mean, you agree with me that my president, even though he was standing with Her Excellency, instead of saying Adamawa, said Taraba. So we can understand not only Tele, even now, my president's wife still takes his breath away. And so, no, let's come on. Go back. I'm coming to it. And therefore, I'm bringing some critical. I will try not to visit Chairman's case and things so that I won't bog you down. But I will just take one. The death of Ifunanya Wange did not occur because medical science failed in Nigeria. It occurred because the system failed. Snake antivenom is not an experimental medicine. It is a basic and life-saving essential that should be be routinely stocked in hospitals, particularly in snake-prone regions of the country. I remember during my NYC in the camp while we were there, there's a young lady in Yoruba girl, Papa, that was bitten by a snake. And you won't believe it, a man. We took her to Jude Hospital there. There was no anti-snake venom. I found back in 1983. But the director of the camp had some anti-snake venom because she knows that there were snakes in the camp. But those of us, we were not told there were snakes so that we could be careful. And the ones in his refrigerator were properly stored and they had expired. And we were watching, the medical team was watching this woman translating a large ebbing out of her, this young lady. I rose up as a pharmacist, knowing something from my life, metabolic studies and the rest of them. And I said, even if this drug has expired, we may still have up to 70 to 80% of the active ingredient. And I therefore posited that this girl should be given this particular anti-snake venom. And it will hold me to ransom if anything goes wrong. But I'm confident it will be very, very unfair to watch her die and we never intervene. I'm happy to say that that anti-snake venom was given and this girl survived. Snake antivenom, let's go back. Snake antivenom, let's back. Is okay. And so, therefore, the absence of the snake anti-snake venom reflects great failures in procurement, planning, supply chain management, and the rest of them. Next slide. Next slide, please. Therefore, this tragedy exposes a deeper and uncomfortable truths. Clinical dominance without systems competence cannot deliver a functional healthcare system. If you say you are the head of the team, God bless you. If you say you want to dominate the health, God bless you. But without competence, it will lead to system failure. And I'm sure that any person that practices or delivers healthcare or does things in the healthcare system in the absence of a pharmacist is actually preparing to fail. Can I see my slide, please? And so leading a modern healthcare system requires more than the bedside clinical expertise. It demands healthcare system thinking, logistics intelligence, pharmacoeconomics planning. And I remember Dr. Zakari, when you mention logistics intelligence, health system thinking, and pharmacoeconomic planning, inventory control, and multidisciplinary leadership, you can owe that to him. These are competencies in which pharmacists are extensively trained, yet they remain systematically excluded from strategic and executive decision making within the Nigerian healthcare architecture. This is sad. Next slide. The repeated loss of Nigerian lives to preventable causes is a clear signal that the current leadership model of our healthcare system is no longer fit for purpose. I hope I may not be coming too hard, but that's the truth. Persisting with the same structure, the same leadership philosophy, the same outcomes, while expecting different results, is not reform. It is simply negligence. Nigeria does not need more rhetorics or recycled policy makers and statements. We need to move forward to help our system. Next slide. Pharmacists need decisive structural change. Pharmacists must be formally embedded as clinical and system leaders, not relegated to auxiliary roles. Essential medicines, including antivenoms, must be treated as national security priority, not logistical afterthoughts. Health policy must be driven by data, economics, outcomes, and accountability, not professional hierarchy. We should see those that can provide these things. If pharmacists, Cyril should tell us that this herbal drug can do this and that, you can hold out to ransom if he doesn't do what he says. But if he says what he says and it comes out, then you should hold her and promote her and enable her to deliver these things, if nothing else, to Nigerians, especially of the lower region. And therefore, we must also realize that we need ourselves to be able to do the next slide. Political leadership must demonstrate the courage to realign health sector leadership with the competencies required to deliver measurable life-saving outcomes for Nigerians. Permanent Secretary, sir. Commissioner of Health in Adamawa, can you just tell us his professional status, sir?
Okay, the Commissioner for Health is a nurse.
Let's clap for Adamawa. To get the right person with the right competencies that can deliver the right thing. Your Excellency, leadership is ultimately judged not by intentions but by outcomes. No, can we go back, please? If systemic failures are allowed to persist, more names will be added to the ever-growing list of avoidable deaths. That is a body no nation aspiring to development, dignity, and global relevance should be willing to carry. Nigerians has the expertise. Nigeria has the professionals. What is required now is a political will to deploy the right people in the right roles to save Nigerian life. Next slide. The need to establish faculty of pharmacy in this one of the states in Adamawa cannot be emphasized. I think Madam Deputy Governor has said so. And I believe I want to say that your prosperous work in the pharmacy space has been properly synthesized as well and will be well crystallized when executed, when you start the School of Pharmacy. I posit here, Your Excellency, that PSN, NAPA, our brothers and sisters in diaspora, will promote and shall massively ensure the success of such a faculty. The relevant key national stakeholders like Pharmacy Council, PSN led by our able President Tanko Ayuba, the Nigerian Academy of Pharmacy with our Vice President, our past President, Yakasai the Catalan of Kano, and government agency would advocate for policies that will support especially pharmacists' workforce. These efforts should include national consultation, white papers, engagement with policymakers to promote the establishment of structured postgraduate pharmacy training. Next slide, please. I believe that not everything needs to be rushed in order to be successful. Strength is staying present through the process and not rushing the outcome. The world celebrates speed. That's why our young pharmacists want speed. But real strength to me often looks like showing up patiently, consistently, trusting the process and work, and in allowing progress to unfold in its own time. Pace momentum is built by your presence and not under pressure. Because when you're under pressure, you could do a lot of funny things. Remember that the process deserves as much respect even as a result. Next slide. My conclusion, modern health systems require you and I, professionals, to combine specialist practice expertise with advanced research capability. For pharmacy, this moment presents a strategic opportunity to strengthen our postgraduate training structures, develop specialist pharmacy expertise, and align professional education with national health priorities. Through our thoughtful policy development, strategic partnership, sustained advocacy, we can help shape a new era of postgraduate training, even undergraduate training, that will strengthen the Nigerian healthcare system and promote pharmaceutical excellence. Next slide. And so, with failure on a lower platform, success on the higher platform, and you believe you are the best, you are in the air, and obviously you wish not to fall in between the two cliffs, but to actually jump and be on the path of success. I believe the PSN, led by able president, pharmacist Tanko Ibrahim Ayuba, will lead us not just to the promised land, but successfully achieve what we should achieve. Next slide. Last slide. Thank you for your attention.
Now you know.
is money?
It's nothing.
Ballin', ballin'. Premium or nothing.
When them or nothing.
Now you know.
Now you know.
Now you know.
Now you know.
Forget what they know them. Yeah.
Iba. Apa. Come on. Iba. Iba. Apa. Iba. Iba. Apa.
I don't know why we normally go and bring people from outside to give us keynote address when we have talent like Prof Cyril Usifoh in-house. For you to know that the keynote address being delivered is having an impact. You watch, if anybody was sleeping or dozing during the keynote address, you see that everybody was following with rapt attention. Prof, thank you very much. You deliver your keynote address professorially. Thank you very much, President. The Pharmaceutical Center of Nigeria hereby present this appreciation award to you in recognition of your role as speaker at the masterclass session with the fellowship of this Colloquium
Undefeated, undisputed, unopposed, luxury or nothing. Money is talking, money is talking.